the microenvironment is made up of a whole, panoply of cells, fibroblasts, macrophages, mast cells, natural killer cells, white cells. And so I think the microenvironment issues are a number. Okay, so the first thing is there is a new technology called a nanostring technology, which has been around for a while, but it's been recently modified, where you can take a section or a number of sections through a patient's tumor biopsy, and you can really study in detail the localization of different white cell populations and fibroblasts and tumor cells within this microenvironment of that tumor. And it obviously doesn't cover the whole tumor because it could be differences in a metastasis in the lung and in the liver or in a lymph node, but it still gives you a nice picture of what the immune response is to that cancer. And it can also be done sequentially, so you can look at the impact of your therapies on this distribution. So understanding the microenvironmental package, if you like, and relating that to patient survival and to response to therapy is really going to undergo a major evolution over the next year, 12 months, 2 years. And we've actually just acquired that technology in our own lab. And we're combining that technology, as will many other labs be doing too, with looking at markers in the blood. And there are different packages of markers, again, in the blood, in the urine and saliva, okay? So you can look at circulating tumor-free DNA, for example, in the blood. Saliva is a rich source of that, but even richer is probably going to be the urine. And the problem with the urine has been, up till now, the DNA is very fragmented when it comes out, but the technologies are allowing us to begin to merge those findings together and say, oh, well, now we can see there's a mutation here or whatever, okay? So we're going to be, and then the other area that you may be aware of is the area of exosomes. So exosomes are little packages of RNA, DNA, proteins, and you can isolate them now quite easily, and then you can look at what's in them and find out if they're prognostic or whatever. So we're going to learn more and more and more about the interaction of the host with the cancer, because the cancer, although it is self, is actually a bit like an infection, and it's how your host deals with that. So there are some new drugs coming through that actually specifically target the microenvironment that have had some very interesting clinical results, response rates. So we're waiting to see what happens now as they move into phase 2 and phase 3 testing. So I think it's an area that is very exciting in terms of how we're going to be able to understand the interaction between the tumor and the microenvironment. Because in a way, the microenvironment is created by the tumor, and it's also created by the host in terms of trying to deal with this wound that doesn't heal. Old-fashioned medicine, but it is true, yeah. So I think an exciting area for the future.